Meanwhile, India is witnessing a steady rise in the number of the COVID-19 infections in the last few days. India has reported as many as about 4,421 infections and about 114 deaths. Now, Maharashtra remains the worst affected state, with the number of confirmed infections crossing the 700 mark. The two privately owned hospitals in Mumbai have now been sealed after the medical staff, that is doctors and nurses in this case, tested positive for the COVID-19 infections. 3 doctors and 26 nurses tested positive for the COVID-19 infections at the Wokhad Hospital in Mumbai Central. The hospital has now been sealed off to prevent the further spread of the infection. New admissions of the patients were stopped, and OPD unit was also shut at the Jaslok Hospital in Mumbai after a hospital staff tested positive for the virus. Meanwhile, all of the officers who were in direct contact with the infected CRPF doctor have also now been put under quarantine. They've all tested negative for the virus. However, according to the WHO and government guidelines, they have to complete a quarantine period to eliminate any possible viral transmission. And also, in what is being described as a novel move to contribute for the funds to fight against the coronavirus infections, the cabinet has now passed an ordinance that will reduce the salaries of the members of parliament. The members of parliament by 30% for 1 year. But they'll still continue to get many other facilities that they continue to get as members of the parliament. The president, the vice president, the governors of the states have also voluntarily decided to take a pay cut as a social responsibility amidst the crisis. The money, it is estimated, will be about 60 crore rupees. That is the amount of money that is to be saved by this 30% pay cut, will go to the Consolidated Fund of India. In another move, India has also lifted restrictions on 24 drug exports amidst this coronavirus infection crisis. The restrictions were imposed last month as the viral outbreak had disrupted the global supply chain of the drugs.